Hi, I am Brittany with Birth It Forward, certified birth and bereavement doula, certified yoga instructor, and family photographer. I am here today so we can talk about some IV fluids. So let's start with IV. What does that stand for? That stands for intravenous. Intravenous means that you will have fluids placed directly into your vein so that you can stay hydrated during whatever procedure is happening. We are here to talk mainly about birth, so most of what I'm going to talk about is birth related, not anything else. IVs can be placed in many locations. Most common locations, especially for birth and labor, are in your arms. So you might have a really good vein in your elbow area. Try not to put anything where you have movement capability, but you can get it in your arm here or in the back of the hand or even in the wrist area. Sorry, my camera's really high today. Anyway, it's not placed right. So you've got many areas that an IV can be placed in your arms. Most nurses prefer to place them on your non-dominant hand, but if they're not finding a really good vein, or maybe all of the equipment is on the right side and you're right-handed dominant, they'll still put it on your right hand. So it just kind of depends on the room layout, where the equipment is, and where a nurse is able to find a really good vein. So some of the most common solutions that you can find in an IV are saline, Ringer's lactate, and a dextrose solution. So saline and Ringer's lactate are what's considered an isotonic solution. So what they do is they allow water to flow freely at the cellular level. So it's allowing that water to flow in and out of the cells without making the cell shrink or swell. And then you've got a dextrose solution, which is a sugar concoction derived from corn or wheat. And those solutions we consider the closest to glucose as we can get. So what we're doing with that is we're helping to provide the body with some calories so it has some energy. It's similar to doing like a carbo load before a fitness event, or using maybe Gatorade or body armor just to help balance out the body again, giving that energy and rebalancing the sugar levels. This solution becomes hypotonic. So what that's doing is it's pulling more water into the cells. So you're going to see some swelling with that. Some big things to note. Current recommendations are to drink through labor. However, we do still have lots of hospitals that do not like their patients to eat or drink throughout labor. So they might provide you with some ice chips. But that's not to say that you can't bring a drink or ask for some water and push to get that water. You can ask for a saline cap if you don't want a full-blown IV, or if an IV just isn't necessary. There are times that an IV is going to be required, such as if you get certain pain medications. Those are often administered through an IV, and then they want to make sure that you have enough fluids in your system to process those medications. Getting an epidural is also one of those times when you're going to be required to have an IV. So an epidural, we're not really talking about epidurals during this video, but I'm going to explain a little bit so that we can understand why we're getting an IV with the epidural. Epidurals have been known to drop your blood pressure levels, and an IV helps to rebalance those. So what they're going to do is give you an IV, an entire bag, so I believe it's a liter worth of IV fluids, in order to help make sure your blood pressure levels are going to stay at the optimum level when they give you that epidural. And then you are required to have an IV for Pitocin. So Pitocin is also one of those drugs that is administered through the IV along with the IV fluids. So again, you can ask for a saline lock. That way you have quick access to a vein and IV needs for if there's an emergency that happens, or just so that you're not having to sit still throughout your labor and contractions while they place an IV for you to have your medications. Hydration is still very important during labor. It has been shown that IVs really do help keep a mom hydrated and keep you with the proper levels of fluids in your body. Because it has been shown that if you are well hydrated, your labor can be shortened by about 30 minutes. And that's not just saying it has to be an IV option of hydration. You can also do oral hydration. So water, like I said, Gatorade, Powerade, any of those combinations, coconut water, those are all great options. Body Armor, which is a coconut water option. So as long as you are staying well hydrated, not necessarily listening to your thirst signs. I can't think of the word right now, but not necessarily looking for like listening to your body in the way of thirst, but just drinking on a regular basis to maintain that hydration. You are very distracted with contractions, so you may not notice if you are thirsty or not, or you might have already been dehydrated. So if you're dehydrated, of course, they're also going to say we need to do an IV to make sure you're well hydrated. Those people with a dextrose solution, there were studies that showed their labors were shortened by about 353 or so minutes. And then they also showed that they used less Pitocin. So it has been shown that saline and Ringer's lactate show no difference in baby's blood sugar level or APGAR scores, which is a good thing. However, dextrose solutions do show slight increases in baby's blood sugar levels, but also no difference in their APGAR scores. So having some knowledge of that so that you can kind of understand if your baby has blood sugar level issues, we can kind of help navigate that by just knowing it's a possibility. Some things to look for, basically some risks, some things that can happen if you've had an IV. So baby's birth weight can be affected with an IV through birth and labor, through labor and birth. Let's switch that around because labor comes before birth. So birth weight can be affected. What we're looking for is after baby is born, it's totally normal for baby to lose some weight. Babies automatically retain some water weight while they're in the womb, and then they have to get that out somehow. So it's perfectly normal for them to have up to a 7 to 10% weight loss. We are looking for them to have less than 7 to 10% of weight loss. And the IV, if you go with birth weight specifically, that can show a higher weight loss in those babies. So we can navigate that just by taking the 24-hour birth weight. Babies are going to pee out that the extra fluids throughout that first 24 hours of life. And by taking that next 24-hour birth weight, we can say, okay, at this point, now we're going to make sure that in the next 5 days, baby is staying within that 7 to 10 weight loss guideline. Excuse me. I need to take some fluids. You can also see some swelling in mom. You're getting a lot of extra fluids, so that means your body needs to pass it somehow. And especially if you get the dextrose mixture, which holds, it's retaining water within the cells. Your cells have to process that. So you are going to show some swelling. You can do some massage to help move that swelling along. Get some compression socks to help with that as well, and continue drinking, keep drinking to help flush your body of the extra fluids so that you can go to the bathroom more frequently. You can also see some breast engorgement, which will affect your breastfeeding. It just makes it a little more challenging if the breast is hard rather than soft. It makes it a little harder for baby to latch on, but that doesn't make it impossible. It just does make it a little more challenging. So knowing those things and going into it knowing those things already can help you in navigating some of those risks that you might see that are definitely most common potential side effects for parents. All right, that is mostly what I've got. I've got some videos I can link down that are great to watch for added information from doctors and doulas, and I hope to see you again next week. I do a birth tip Tuesday video or a birth story video every Tuesday here on the Birth It Forward channel. And we also do yoga on Fridays so that you can get some movement and hopefully prepare your mind and body for the birth of your beautiful baby. All right, I'm Brittany. Make sure you hit that subscribe button, like the video so I know that you want more of this content, and hit the bell button so you're notified whenever we post a new video. And I will see you on Friday.